We discussed about bedwetting in the last episode. It is very important to know about the management as well. Before we start treating the patient for bedwetting, these children require certain investigations. The basic investigation of urine examination is very important to rule out urinary infection and the disease like diabetes. You also need to do a sonography of the urinary bladder and the kidney to find out whether there are any structural defects in the system. If these two things are normal, very often you don't need a further investigation. But if the child also wets the cloth during daytime when he is awake, this is a little more serious, and we need to investigate whether there is any problem in the lower spine. X-ray of the spine may not be adequate enough to find out the pathology in the spine. So we need to do MRI of the spine. After MRI of the spine, if everything is normal, one of the investigation is also the assessment by clinical psychologist. After all these investigations are done, we go for the management, for the treatment. Dr. Nihar will explain you the treatment of bedwetting.
Thank you, sir. So the management, the treatment of bedwetting has a lot to do with patience. We all guide our parents that post 5 years, if the child wets his bed, he needs to see us so we can help the journey become a little easier. Primary nocturnal enuresis and secondary nocturnal enuresis, like we spoke about in the previous episode, have different managements. Let's start with secondary nocturnal enuresis. It's very simple. Treat the cause, the bedwetting will stop. There is no rocket science to that. But the complexity of treatment starts when we are handling primary nocturnal enuresis. Post 5 years of age, we want to start managing that. Children at 5 years of age require a lot of strength, a lot of care and patience from the parents. The first thing is the bladder control therapy, what we say. Post dinner or 2 to 3 hours before the sleep, we advise the parents not to give any liquids to the child. Before the child sleeps, you take him to the bathroom. Put an alarm 4 to 5 hours later and take him to the bathroom again. Keep doing this. It's not going to be an overnight change. It's going to take at least 3 to 4 months of doing this till the bladder and the brain connect well and enough coordination to wake the child up and stop the bedwetting. Even after doing this, if it doesn't help, we try to move on to medications. Medications are certain oral medications which help to improve the imbalance in the hormone which controls the bladder. Second are nasal sprays which help to gain strength in the muscle of the bladder and are also hormones which reduce the nighttime formation of the urine. Sometimes, in very rare cases, antidepressants are used so that the bladder controls easier. Along with all this, psychotherapy, like Sir mentioned, is extremely important to rule out the underlying cause of ADHD, if there is any, to strengthen the emotional quotient of the child, to make sure he can handle this. And this works more in children who are suffering bedwetting even after 8 years of age. Counseling them, how to handle social situations, how to never lose hope. Keep a diary, where you can record the number of wet nights in a month, see them reduce in number and reward the child for that. And lastly, there are certain alarms, specific alarms available which are connected to the undergarments of the child. With the minute the undergarment gets soiled, the alarm rings, wakes the child up and makes him or her go to the bathroom. But this is only useful in children above 8 years of age. But if we are patient, this all 90% of bedwetting, primary nocturnal enuresis stops by 10 to 11 years of age. So let's be patient. Let's get the right guidance for our children and take and choose the right therapy.
There is one more investigation done for bedwetting. This investigation is not routinely done, particularly if the child keeps on passing urine at night after 8 to 9 years of age, and when the child has a dribbling of urine when he is awake. And this is known as urodynamic studies. These are done in institutes. And urodynamic study tells you about the function and the structure of the full system which makes urine, which collects urine, and which passes the urine outside. Tune into our channel, Child and You, for tips and guidance to raise a healthy child.
Live now, live healthy, only with Sushruta. For any queries, you can write into us on or WhatsApp us on